And we're live. Good morning or good afternoon or good evening. Depending on when you watch the show, being watch it live or the recording. This is the Healthcare Thought Leadership LinkedIn live show. And we're glad to be here on this Tuesday, April 29th. If you're joining us live, post in the comments, let us know that you're there. I'm very excited once again to have my colleague and returning guest, Jake Weiser, here. And we're going a little bit deeper on the work that he does. And today our topic is do no harm. Future ready leaders and boards are the keys to success. Jay and I connected several months ago around his work with boards, with leadership development and his program. And we had such a great response to our first episode. And by the way, if you'll check into the comments a little bit later, I'll send you the first episode so you can check that out. Jay, introduce yourself to our audience. Glad to have you with us today.
Happy to be here. So Jay Weiser, and what I do is I work with leadership teams and boards on helping them become future ready. So when you think about all the turbulence in the world that's been going on seemingly unceasingly, the way we used to manage, the way we used to govern no longer works. So it's about how do we become future ready? How do we become more flexible and adaptable? And that's my game.
Well, you had one of the things that was exciting about it when we talked, you had come up with these 5 key pieces and talk about that framework. And I know you're going to focus on 2 specific superpowers, but talk a little bit about, for those who have not watched the show before or know about your work, Jay, tell us a little bit about those 5
Sure.
superpowers of leadership and give us a little bit of insight on that. And then we'll go a little bit deeper from there.
Sure. So, by way of background, the 5 Leadership Superpowers is a framework to help organizations become future ready. And it really comes from a combination of research as well as observing what our high-performing companies, high-performing boards do. There are 5 superpowers. Each one of the superpowers is about balancing attention that leaders need to navigate. The first one is being a present futurist. So it's being able to work in the present while keeping an eye on the future, understanding the current environment, current stakeholders, but also monitoring trends and looking forward. Second is being an experienced learner. So experience is great, but it has its limits. So it's being curious, being open-minded, being a continuous learner. Third is being a prepared risk taker. We all know risk is a part of business. Doing something or not doing something entails risk. So it's being about smart risk taking. You need to do that to grow, to innovate, but it's also about being more risk aware and having more of a posture of preparedness. That helps you be resilient. Fourth is being a strategic executor, balancing strategy and execution, strategy and operations. So focus on execution and operations, but keeping an eye on the future so you don't do something today that's going to impair your ability to be successful tomorrow. And fifth is being an accountable collaborator. So it's recognizing, especially in healthcare, but really in all major complex challenges, requires collaboration across the organization and also across your ecosystem and with your stakeholders. And at the same time, that collaboration is focused on delivering outcomes. And the team owns those outcomes, and the team is accountable for delivering those. So that's the 5: present futurist, experienced learner, prepared risk taker, strategic executor, and accountable collaborator. And the 5 reinforce and support one another.
When we talked last, one of the things you and I talked about and you stressed was this idea of being, prepared for the future. And and your phrase is are they future ready? Are leadership teams future ready? And I would love, before we talk about the two specific superpowers you want to dive into today, what are some signs or what are some indicators that senior executives would have that would say, hey, my team is not future ready? We're not future ready leaders. In other words, how do we identify in the minutia of everything we have going on? For those of you who don't know me, I run an executive search and leadership solutions company called Inflow Executives. It's a company I founded last year. It's my third iteration of this work that I've done for 35 years. And one of the things that I talk about a lot with my clients is this very thing: is what's the team look like for the future? Do you have the team in place? But Jay, I would love for you to talk about what are some of the hallmarks of teams that are not future ready. And then I would love for you to kind of dive deeper into the two
Sure.
areas that you want to focus on.
So I think one of the first signs that you're not future ready is this idea that you're continually caught off guard. You're surprised. It's like, where did that come from? When you probably should have seen it coming. When there's a tendency to say, leaders are saying, I don't need training. I've done this for the last 20 years. I know how to do it. But then you find out that's really not working. So it's that inflexibility. It's a reluctance to innovate. It's organizations that tend to be defensive and wonder why they're not growing, why they're not innovating, because people are afraid. And it's organizations that are trying to figure out how to deliver quality care, a great patient experience, but can't seem to do it because of the silos. Each of those is a sign that you're not up to snuff. You're not future ready.
That's really important to keep in mind. And I think it starts from the top. You and I talked about in our first conversation around the board of directors, and what does that look like? But Jay, I'd love for you, to go a little bit deeper, pick another one of those. I love all the five elements that you talk about in those five superpowers. I love them, but tell me a little bit about what, with the work you've been doing lately, what's one of those superpowers that you've been really having to drive home with teams that maybe we could go a little bit deeper on today?
So the first one I want to talk about is being a present futurist. And, that goes to leaders and boards who are constantly surprised when things have been hiding in plain sight. So it's this idea about robustly understanding the present environment, understanding who your stakeholders are and what they think about what you're doing, and what are their needs, whether it's patients, whether it be vendors, whether it be your employees, whether it be the communities you're in. At the same time, these organizations need to have a vision of where they want to go in the future while they're tracking trends and signals. So if I was a healthcare organization and say, following the election, it should have been on top of your mind about, well, how are federal funding programs going to evolve? What's going to happen to Medicare, to Medicaid? What's going to happen potentially to research? That should have been on your radar screen going back to last summer, if not earlier, and certainly when the elections hit. Because boards and leadership teams were saying, oh, I didn't see that coming. That's negligence. It was right out there. And it's paying attention to trends like AI, other technology advancements. It's looking at different business models. For example, where, if you look at a company like CVS, they're integrating healthcare delivery, pharmacy benefit management, and consolidating and recognizing that there's work that can be done across the system. You think about a company like Kaiser Permanente, very early on spoke about connected care. Having a system where your primary care doctor talks to the specialist and there's a seamless experience. Or if you think about the Mayo Clinic or companies that have invested in telehealth, they saw these things coming. If you're late to, you see that late and you act on it late, you're already behind.
Yeah.
And I think the other thing, when you think about being a present futurist, it's thinking through those what if situations. So running through different scenarios, having the leadership team discuss, what could possibly happen. You're not going to do every scenario, but recognize these things are interrelated. So if I'm in a healthcare organization now, I probably should be thinking about supply chain because of the tariffs. Where am I getting my medicines from? Where am I getting my supplies from? How much are they going to cost? What other sources could I be looking at? At the same time, reimbursement rates, value-based care, all these things are coming in. So if you look at a scenario that picks a few of those, you start to see how they interrelate. And thinking about it helps you adapt to it because you're having those discussions early instead of after something happens.
When you talk with a CEO or board of directors or any leader for that matter, and they push back and say, I don't have time to keep up with everything. I have to focus on my tactical situations at hand. How do you share with them how important it is that spending that time understanding the market, thinking about the changes that are coming in the pipe? How do you help them reframe how they apply their time in the context of what you just shared?
Well, I think part of it is making it more explicit. What's the risk if you don't do this? Because a lot of times people assume that no action equals no risk, and no action can key up a lot of risk. I think it's the idea that, doesn't mean they're spending all their time doing this. It doesn't mean they have to do it personally. It might be they have somebody in the organization who can track some of these trends, who can report these things up, who can pose questions to the board or the leadership team. I'll tell you one thing that is an amazing tool is making use of AI. And simply putting into ChatGPT and saying, I'm the president of a rural hospital in such and such state. What are the top 5 things I should be looking at coming down the future? You see what that list is, and you say, well, which ones affect me? And then you can start drilling down. But you can get that from AI in an instant. You can spend more time talking to your different stakeholders, talking to your employees. As we all know, burnout and staffing is a challenge. So having those discussions, so you kind of get a sense of what's on people's minds, how they're feeling at work. That is another piece of information. Again, what you do today prepares you for tomorrow. If you wait until tomorrow, again, you're behind. Who can afford to be behind right now?
No one. When we think about this situation as well, as leaders, where you mentioned the Chat GPT piece, that's a great idea. It's a great suggestion to help them kind of reframe what their questions are. What are some other resources they have? And I want to come back. I want to talk about that a little bit, but I want to come back to how you help them understand that. But What are some other resources that they should be paying attention to? What are some other areas where they need to stay informed and stay on top of things? What are some other, can you give us some other options in that regard, some other ideas around that as well?
Sure. I was thinking quick and dirty, but reading healthcare periodicals. Becker's puts out a newsletter every day. Dive into some of those articles. If you see an article, whether it's you or another member of your leadership team, spend 10 minutes talking about that particular issue so you're up to date. It's looking at federal policy. I mean, reading the Wall Street Journal, seeing what's coming, speaking to your congressman or your senator, speaking to your state regulatory boards. There's a lot of stuff out there. Read The Economist. There are general business publications, because it's not just reading about healthcare, because not everything is healthcare, but it happens in another area or supply chain that becomes very relevant for your organization. So think about periodicals or sites that are in adjacent spaces. It's important to go to conferences or send somebody so they can bring those things back and integrate that in.
And I would echo what you said about, obviously there's a lot of options. There's Modern Healthcare Magazine, there's the Economist, there's a plethora of other resources. I start my morning every morning after I do my devotional. It starts with the B, it starts with Bible, and then the next B is Becker's. I read it every morning during the work week. So, matter of fact, there's an article today about the crackdown on knockoffs in drug compounding. Federal court backs Novo Nordisk and crackdown on knockoff GLP-1s. And then there's some notes about that. And how does that impact healthcare organizations? This was in Texas. They have to be, it'll create supply chain issues, right? And now we're thinking, okay, what's the supply? It allows us, if we read that article, now we got to think, well, what other supply chain challenges may we have? That's just one in the pharmaceutical side. So I love that section of it. Where when you think about the other superpowers, I really like that being a present futurist. That's fantastic. Is being in the moment, in the present, but also understanding the how do we look at the future? What's the second of the superpowers that you feel like is so relevant to our current situation in the marketplace right now that you'd like to talk about?
So I think, again, especially for healthcare, but this applies across all organizations, is breaking away from that siloed mentality. There is nothing worse than a leader saying, when you're dealing with a complex situation, stay in your lane. That's the last thing you want your leaders to be doing. Staying in your lane is great if you're in a track meet or a swim meet. But if you're playing football, basketball, soccer, any other sport, it's the team, and it's how the team works together. And if you think about the ideal patient experiences, involve the collaboration of teams, whether it's and even going outside your system, payers and providers, regulators. How do you get these groups working together? How do you build confidence with your partners across the ecosystem? I can talk a little bit, with personal experience. Recently some health issues with my dad, with my father-in-law, two different hospitals in Metro Atlanta, completely different experiences. In the case of one hospital, my wife and I had to be the glue, because we would talk to different doctors and say, "Oh, have you spoken to so-and-so?" I'm not a healthcare provider, but I have to jump in the middle. I have to learn and try and figure out who needs to connect to who. But what if somebody is not as able to do that, what falls through the cracks? And that's scary.
Yeah,
Whereas
it is.
this other institution, the teams came together, they talked to each other. They realized, I can't do this without talking to so and so. So that seamless care, but that also affects quality, that affects cost, that affects reputation.
Mm-hmm.
That if you're not collaborating, what costs are you incurring as a result? What negative outcomes are occurring because of that result?
Mm-hmm.
So it's the team working together on a particular challenge or issue and being accountable for what those critical outcomes are, whatever they happen to be.
Mm-hmm.
If it's working across channels, if it's working across departments. I mean, it can be simple as the medical side, the nurses, billing, all these things tie into that experience. And it's recognizing teams can be accountable. It's also, who do you put on those teams? Who are the right
Mm-hmm.
people? Not just who's available, but you might have the head of a medical department working with a mid-level nurse who works on that specialties floor with the case manager. It's because those levels need to talk to each other. They need to understand what's happening. And those collaborations, those communications are essential. If you think about the board, you don't want your board members operating in silos. Oh, Joe does AI, Mary does
Mm-hmm.
finance.
Yeah.
Well, they need to talk together. Boards are responsible collectively for these issues. So you need to create an environment, if people are collaborating, they respect each other, they trust each other,
Mm-hmm.
they're open to talk with each other, because they can't succeed individually unless the team succeeds.
Yeah, I think that's really critical. And I think from the top down, I work with boards all the time, and that setting the tone for collaboration, being willing to collaborate, being willing to open to, and be willing to being open to other people's ideas, not just their ideas. I think that's really critical. Throughout healthcare, you mentioned it earlier that it's very simple and very easy to be very siloed. The doctors work with the doctors, the nurses work with the nurses, et cetera. It might be, however it might be. And I think that's a really critical piece. Checking in, by the way, echoing some of the stuff you're talking about, is Christine Park checking in from Kansas City. And she makes a really good point here. She talks about that she looked to design the user consumer patient experience. It's absolutely necessary to include the end user into the workflow process design. I'd love for you to speak to that, Jay. And Christine, thank you for watching Healthcare Thought Leadership Live and sharing your thoughts in the comments. And if anyone else is watching live, please let us know your thoughts or comments. What are your thoughts about how important it is for the end user to be involved in this process? Thank you for your comment, Christine.
The end user is the customer, the patient. It's
Mm-hmm.
that person's outcomes, it's that person's experience that is front and center. When you think about quality of care, and
Mm-hmm.
it's not enough for a nurse to say, "Oh, I think that this is important to the patient," or a doctor to say, "I think this is important." If you don't talk to the person, you don't know. You're making assumptions that may or may not be right. So by engaging in that person, they're part of the system. One of the biggest fears I think patients have is being out of control, things being out of control.
Mm-hmm.
What are they not telling me? Why aren't they working together? One person comes in and says, "I'm doing better." The other person comes in and says, "Oh, this is a concern," which
Yeah.
is so I think that coordination, when a patient raises those issues, it's an opportunity for that institution to say, "How did that happen? what can we do to change that? Who needs to work with each other to make that experience better? And it's the same thing. If it's your IT vendor and you're not talking with them about how that ties into patient experience, what people can see on the portal, what they have access to, there are breakdowns there. By better partnering with your vendors, whoever they happen to be. Facilities management, different people, the cafeteria or in the hospital. How do we work together?
I think that's really a key piece. Jay, every time you and I get into a conversation, it flies by. It absolutely flies by. And we're almost out of time. Jay, talk a little bit about how you specifically work with boards and with leadership teams, and how our audience can connect with you.
So first of all, in terms of connecting with me, connecting through LinkedIn is the quickest and easiest. Just by looking back at LinkedIn at the session, you can connect with me. You can send me a direct message. You can email me at jay@jaywiser.com, JayWeiser.com. Now, in terms of how I help, one is around executive briefings, education sessions, having a discussion with your board, talking about the challenges of future readiness, and then getting into how that applies in their work, how the superpowers can help them address the challenges they're facing. I also do leadership and organizational assessments. So if somebody connects with me, I can give them a link to my online "Are You a Future Ready Leader" assessment. So I share a lot of my content there. So assessments, education programs, and helping companies implement these, because teaching the concepts, showing them doesn't matter unless you can apply them and you know where to apply them in your work, how you design different processes, how you strategize, how you plan, and how you prepare. That's where the rubber meets the road. That's where additional value is created for your employees, because they like that they're being respected and their input is valued. Your patients, because they're getting better outcomes. Your partners, because you're easier to work with. Whether you're for profit or not, your communities, your shareholders, they see how you're working in their best interest. So, and same thing with your employees, doctors, nurses, if they're working better together and they're delivering better outcomes, they're recognized and rewarded as well. So it's tying all those pieces together.
You mentioned, we've talked about it before, you mentioned your Future Ready assessment. Is that something you offer for free to,
yes,
and people can take it?
Yes.
So after the show, would you be willing to put the link to that in the comments? And if you're watching the show live, okay, great. If you're watching the show live or you watch the replay, click on that link and you'll be able to take that assessment and see where you are in terms of being future ready. Last question I have for you today, Jay, and I really appreciate you coming back on the show the second time to go a little bit deeper, because you work with the same audiences and same clients that I do, and it's great to build that collaboration. You and I provide a variety of services to the market. A lot of the people that watch the LinkedIn Live show, the Healthcare Thought Leadership LinkedIn Live show, are young leaders or early careerists, because of some of the teaching that I do at different universities and just my network. What's advice you would give them about being a future ready leader? It's probably a lot of the same things that you've already shared, but as a young leader coming up or fairly new into that role, what are some things they can do to differentiate themselves from other people in the market that they're going to be competing with?
So I think it's just really important to go in eyes open. Think about ways you can build your awareness. Think about ways that you can collaborate with other people. I have a nephew who's in residency, and working with each other is far more effective than trying to compete for who can be better. So thinking about that collaboration, reading those periodicals, helps you stay up to date. You'll ask better questions. If you're a medical student and you're paying attention to these things, you can add so much more to the conversation by sharing that information.
Mhm.
And asking those things. Don't be afraid to ask questions. Never stop being curious.
Massive piece of the puzzle right there. Always ask questions, continually ask questions. And I think that you talk about your 5 superpowers. I think asking good questions are really one of mine. So that's absolutely on point. Jay, we're out of time now. I have posted in the comments for those of you who are watching live or watch the replay, both Jay's LinkedIn connection and his email address. He will post after the show a link to take that assessment. And I encourage you to do that and connect with Jay. For those of you who are watching or not connected with me, please send me a connect request here on LinkedIn. This is the Healthcare Thought Leadership LinkedIn live show. I host it on Tuesdays 2 to 3 times a month now from the mountains of Georgia where I live. And we discuss a lot of different topics. If you're interested in being on the show or want to know more about how you could be a part of it, please also DM me and connect. Jay, absolute pleasure. Thanks for working with me, being flexible about scheduling. And I'll bid you have a great day. Thank you for being on the show.
My pleasure.
Absolutely. And have a good day.